Welcome to Dr. APOE4, where we decode the science of aging to help you live longer and better. I'm Dr. Grant Fraser, and today we're exploring a provocative and increasingly relevant question. Could statins reduce the risk of Alzheimer's disease, especially in people with the high-risk APOE4 gene? We know from several population surveys that individuals taking statins seem to be at lower risk of Alzheimer's disease. But what about those individuals with an APOE4? Some scientists have felt that statins were bad in this context and especially had concerns with statins that were lipophilic and could get into the brain. The dogma with some has been that one needs high brain cholesterol and low peripheral cholesterol. Well, this new population-based cohort study provides compelling evidence that statin initiation is associated with a significantly lower risk of Alzheimer's dementia and slower cognitive decline, especially in those carrying the APOE4 allele. In this episode, we'll break down the study design, findings, and clinical implications for patients and providers alike. So why does APOE4 matter? The APOE4 allele is the most well-established genetic risk factor for late-onset Alzheimer's disease. By late onset, we generally mean onset in those over age 65 years. People with one copy of the allele face a 2 to 3-fold increased risk, while those with 2 copies may have up to a 10 to 15-fold increased risk over a lifetime. The APOE protein plays critical roles in cholesterol and DHA transport, glucose metabolism, and modulation of neuroinflammation in the brain. In individuals carrying the APOE4 allele, these functions are impaired, contributing to increased amyloid beta accumulation, synaptic dysfunction, and accelerated neurodegeneration. This study focuses on whether statins affect cognitive outcomes differently based on APOE4 carrier status. So let's talk about the study design and population. This was a longitudinal population-based cohort study conducted across 4 urban communities in Chicago, Illinois, with 4,807 adults involved. The mean age was 72 years, and the population was 63% female and 61% non-Hispanic Black. It should be noted that females are at higher risk of Alzheimer's disease, whereas non-Hispanic Blacks are at lower risk of Alzheimer's disease due to APOE4 carrier status. Statin use was verified through direct inspection of medications. Cognitive assessments included episodic memory perceptual speed and a mini mental state examination. Incident Alzheimer's dementia was diagnosed using the NIN-CDS-AD-RDA standardized criteria. Showed a clear APOE interaction with 31% of participants, 1,470 individuals, reporting statin use during the study. Statin initiation was associated with a 19% reduced risk of Alzheimer's dementia. Among APOE4 carriers, the hazard ratio was 0.60, suggesting a 40% reduced risk. Among non-carriers who didn't have an APOE4, the hazard ratio was 0.96, showing essentially no significant benefit. The interaction was statistically significant. Additionally, APOE4 carriers who initiated statins experienced slower decline in global cognition and episodic memory. These effects were not observed in non-carriers. So looking at mechanisms and interpretation of this, possible explanations include an anti-inflammatory effect that counters the pro-inflammatory state in E4 carriers, improved cerebral perfusion and endothelial function, modulation of amyloid beta production and clearance, correction of disrupted lipid metabolism due to APOE4. This is class 2 observational evidence. While strong, it calls for confirmation through randomized clinical trials. Now to summarize what this means, statin initiation was associated with a lower risk of Alzheimer's dementia, particularly in APOE4 carriers, experienced slower cognitive decline with statin use. No benefit was seen in non-carriers. This study supports considering genotype in preventative strategies. These results suggest the potential for statins to be part of the personalized prevention approach for Alzheimer's disease in genetically at-risk individuals. Thanks for joining me on Dr. APOE4. We hope this study has you consider any alternative perspective on statin therapy. If you found today's episode helpful, please follow or subscribe and share with colleagues who want to better understand the intersection of genetics, brain health, and longevity. Until next time, stay informed, cognitively intact, proactive, and well.